we are bound by duty to take measures to make universal health coverage a reality and liberate Kenyans and their families from the threat of harrowing poverty that stalks them every time a family member falls seriously ill. In our plan, and through your support, we will restructure our primary health system so that we put more resources into promotive, preventive, and early diagnosis. A key driver of this realization is the National Health Insurance Fund, whose restructuring is not only necessary for efficiency, but also enables it become a fit-for-purpose social insurance scheme that caters for all, including those suffering from chronic diseases. Digital technology has become a critical player in economic growth. We will capitalize on existing technology and innovation in the public and private sector to distribute the Hustler Fund as promised in our plan. I call upon financial institutions and our young people in innovation to participate in the digital economy by redesigning their products to serve the goal of empowering millions armed with grand ideas and are only waiting for the funds to finance their dreams to reality. Honorable speakers, honorable members, I have news, and it is not very good news. Our financial situation is not very good. For Kenya to grow to an upper income country, we need to invest at least 25% of our GDP. Our current national savings is below 10% of our GDP, which translates to an investment savings deficit of 15% of our GDP. Over the last decade, we have sought to close this gap with public borrowing. This year alone, we budgeted to borrow 900 billion to finance both development and recurrent expenditure. You're all aware that our total collection is 2.1 trillion, which is only enough to pay debt and to pay salaries. Everything else, we have to borrow. The government, members, should never borrow to finance recurrent expenditure. It is not right, it is not prudent, it is not sustainable, it is simply wrong. We must bring ourselves and our country to sanity.